What do a grocery store, a hospital, and an amusement park all have in common? Each one is a place where you wait in line. Now, which line do you hope moves the fastest? I imagine many of us hope it's the one at the hospital. But how do we know what kind of setup and resources are going to give us the shortest wait time? Places like the grocery store and the amusement park may be able to find this answer through trial and error, but the hospital is not such a place. Hospitals need to have great practices that effectively handle the flow of patients. This is why, as a mathematician, I have devoted my research to studying the setup of lines and the allocation of resources within the healthcare system to find what keeps it running smoothly. So, using a strong mathematical theory, I can simulate a hospital, including its beds, patients, doctors, and nurses. I can also simulate random events such as a patient has been admitted to the hospital or one of our doctors has fallen ill. With this healthcare model, I can track all sorts of data to answer questions like, do we have enough beds and providers right now? I can also incorporate the mathematical theory behind predicting epidemic waves like COVID-19 to simulate even more sick people going to the hospital. With this, we can additionally answer questions like, how many of our providers are becoming sick from the infected patients? Or even better yet, should we be investing in more beds or more providers in the coming future? So with this powerful but flexible tool, healthcare administrators and public health policy makers can look at all of the different what-ifs of a situation. So after running my model for almost 2.5 million simulations, I have carefully orchestrated all of those intense recommendations for any given scenario. So how could this be used? Well, as we have an upcoming influenza season, our hospitals could use this tool to see what the projected resources they are going to need in order to ensure that no one has to wait for treatment. So what is most important to the healthcare industry is ensuring that we have the best practices that ensure that no one has to wait for treatment, but we can also alleviate the strain on our healthcare system. And now these resources and these best practices can be found in the time it takes you to check out at the grocery store. Thank you.